This is a beautiful morning in the wonderful weather of Nicaragua. We're in Managua and we're standing outside the best hospital in Nicaragua, Hotel Metropolitano Vivian Pellas. This hospital has been built maybe 3 years ago and it's brand new and it's got the best facilities. The technology is so modern, the instruments and just all the equipment they have is incredible. It's like you would go to an American hospital, like I said before. It has been built by the richest, more wealthier family here in Nicaragua, which is the Pellas family. And people that can only afford to pay this best care can come here, would be the people that are wealthy. And yet I've been working with some of the doctors, and some of the doctors that have come here to work here since it's been open are helping me with the poor children. This hospital has opened the doors for us to have a conference for doctors, nurses, and the course in Spanish is Curso Avanzado de Apoyo Vital en Pediatría. Since we're concentrating in training our doctors and the nurses here in Nicaragua to get a better education so that they can treat the patients better and have better knowledge.
This was a 4-day conference. The first day was lectures on emergency room problems, especially trauma. And then the following 3 days were a pediatric advanced life support course. This has been certified by the American Heart Association for us to do this here. We're doing it really pretty much just as one would in the States. And the people that have come for the course have been very responsive, very interactive. They've just been a real good group to work with. The people in the class, there's some nurses, some physicians, and they also allowed some of the best medical students from the area to come here. And the medical students, they start in medical school right out of high school, so they really are pretty young. The first day was lectures. That was the ER trauma day. And then the second day was also lectures about PALS, Pediatric Advanced Life Support. And that was a little bit more interactive. And they'll be practicing various skills related to PALS, like intubation, airway management. They'll be in smaller groups and just, doing things with mannequins and chicken bones, and they'll have a lot of fun with it, I'm sure. Now we're at one of the stations for the PALS course. At this station, they're looking at arrhythmias or dysrhythmias, basically abnormal heartbeats that people can go into that are many of them potentially fatal. And so there's different ways that you approach the different abnormal heartbeats. You have to be able to recognize them on an EKG, or a rhythm strip actually, and then treat appropriately. And so that's what this station is all about. At this station they're talking about intubation and airway management. Basically how to open up the airway, put a tube on down so that you can breathe for the patient. It sounds very simple, but there's a lot to it. It's actually more difficult than you might think to get the instrument in and use it properly to open up the airway and insert the tube in the proper place. Right now what they're doing at this station is more like what probably most people think of when you say cardiac resuscitation. It's what you see on television, chest compressions, using the big bag to have the patient breathe, holding their chin properly to keep their airway open. But this is a pediatric advanced life support, so it's a little different. You don't bang on their chest like you do adults. Depending on the size of the child, you use different techniques to essentially make their heart pump at least some blood, and the rate at which you do it and how far you compress their chest, it's all different. So it's not like adults. I'd like to thank everyone for coming.
Agradecerles a cada uno de ustedes por estar con nosotros.
It has been a real privilege to get to know you and to be involved with you in this course.
Ha sido un privilegio poder conocerlos y poder estar juntos tomando este curso.
I also want to thank Dr. Ion and Dr. Mendez. We could not have set up this course without them.
Queremos agradecer al Dr. Ayón y al Dr. Méndez que han hecho un trabajo muy grande en esta conferencia. Sin ellos no lo hubiéramos podido hacer.
I'd like to thank the administration of the hospital for inviting us.
Quiero agradecer a la administración del Hospital Vivian Pellas por invitarnos.
And I'd like to thank Flor and Ileana and Margarita because they've been very helpful to us when we were here.
Queremos agradecer a Flor, Liliana y Margarita por la amabilidad que han tenido con todo lo que necesitábamos.
And now we have certificates for everyone.
Tenemos certificados de participación para cada uno de ustedes.
So I will call your name and you can come up and get your certificate.
Queremos llamarlos por nombre y por favor vengan y recíbanlo.
Dr. Ernesto Jose Mendoza. Doctora Violeta Guerra.